pollution and environmental hazards are a rising concern as their mortality rate is increasing every year. Now, environmental hazards were responsible for an estimated 11.3 million deaths in 2019, and 5.1 million of them were from cardiovascular disease. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and I'm going to talk about particular environmental hazards that are responsible for increased risk of cardiovascular death. A recent study quantifies that cardiovascular risk posed by an exposure to specific environmental factors. Now, for example, the air pollution, it heightens the risk of heart disease mortality by 17%. The research that is published in PLOS One journal is the first to examine the impact of multiple environmental risk factors on the cardiovascular mortality and may even lead to increased patient screening and preventive measures to improve chances of survival. The study, which is known as the Golestan cohort study, why is it called so? Because the participants were from the Golestan province, a lower income, multi-ethnic and mostly a rural area where cardiovascular disease is the leading cause of death. The investigators used environmental data to create maps of 8 environmental risk factors across the province. These maps included an ambient fine particulate matter air pollution, how households cooked, heated and ventilated their homes, how close they lived to traffic, their proximity to hospitals that perform percutaneous coronary intervention procedures, neighborhood socioeconomics, pollution, density, etc. Now, they found those exposed to the highest levels of outdoor air pollution were 17% more likely to die from heart disease compared to those who were unexposed, and 20% more likely to experience an all-cause mortality. Participants exposed to indoor burning of wood, dung or other biomaterials without any ventilation were 36% more likely to die from heart disease and 23% more likely to experience all-cause mortality. Now, people that were exposed to indoor kerosene burning without any ventilation were 19% more likely to die from heart disease and 9% more likely to die from all-cause mortality. For every 6 miles participants lived away from a catheterization lab, the risk of cardiovascular death went up by 2% and all-cause mortality by 1%. Now, living within roughly about 0.06 miles of a small roadway and 0.25 miles from a large highway were associated with a 13% increased risk of all-cause mortality. Now, researchers therefore concluded that their work did demonstrate how publicly available data can be used to create risk maps for individual communities, even in rural or low-income settings. Eventually, they also expect health systems to use similar approaches to create environmental risk maps. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.